Good morning to all. Hello. Topic of my presentation is manual small incision cataract surgery under intracameral fixed dose combination of lignocaine 1%, tropicamide 0.2% and phenylephrine 0.3%. As we all know, cataract is the most prevalent cause of blindness, accounting for about 62% of the total prevalence of blindness. Cataract surgery is one of the most effective surgical intervention in terms of quality of life and vision restoration. For a successful cataract surgery, good anesthesia and effective medrace is an important principle. Conventional method of pupillary dilatations are topical tropicamide 0.8% and 5% phenylephrine eye drop. They have their own disadvantages like inadequate bioavailability, extended duration until midriasis appears, subsequent requirement for subsequent administration, and corneal toxicity and systemic complication. And for local anesthesia, we have conventional methods like retrobulbar, peribulbar, subtensive, subconjunctival. They have their own disadvantages like needle-related complications, complications like retrobulbar, hemorrhage, blue perforation, traumatic injury to the optic nerve.
Audio visual, please see.
To overcome these challenges, the use of intracameral combination of tropicamide, phenylephrine, lignocaine has gained attention. And the aim was our study was to evaluate patients' level of comfort, pain perception, safety profile, as well as surgeon experience with the use of fixed-dose combination of tropicamide, phenylephrine, lignocaine in patients with cataract blindness treated using technique of manual small incision cataract surgery. So, it was a prospective interventional observational study was conducted at Tertiary Care Hospital in Jammu on 100 patients over a period of 6 months. All patients of either sex between the age group of 40 to 80 years with cataract and with pupillary diameter of greater than 6 mm on preoperative evaluation were included in the study. Patients with traumatic cataract, uveitis, pseudoexfoliation, pupillary abnormalities or any ocular disease and systemic disease were excluded from the studies. And also patients with known sensitivity to tropicamide, phenylephrine and lignocaine, and patients using drugs like alpha blockers, NSAIDs and prostaglandins, they were excluded. And uncooperative patients like with hearing problems, dementia, high degree of anxiety and movement disorders were excluded from the study. Now, after doing a detailed medical ocular history and systemic ocular examination using slit lamp examination and fundus examination using 90D and indirect ophthalmoscopy, all the patients were put on topical antibiotic drops 4 hourly, 1 day before the surgery. On the day of the surgery, topical anesthetic proparacaine 0.5% was instilled 5 minutes before the surgery twice. And no superior rectus bridal suture was given, and intracameral fixed dose combination was injected, 0.1 ml solution was injected through side port, and then CC Rexus was done through side port with 26 gauge bent needle. After conjunctival peritomy, a sclerocorneal tunnel was made, the frown shape incision was given, and size was about 5 to 6 mm. And depending on the grade of the nucleus, and the delivery was done through viscoexpression, and after thoracortical wash, single piece PCL was implanted, and all the patients were operated by single surgeon, and time taken to achieve mydriasis was noted in mm using Castroviejo caliper. Pupil size was noted at the start of the surgery, 20 seconds after injection of the fixed dose combination, after delivery of the nucleus, before IOL implantation, and the end of the surgery. And patients were followed up for pain and comfort on first post-op day, 1 week and later on. These are the few pictures after injection. Then sensation of pain felt during surgery was recorded on VAS scale, and quality of comfort during surgery was recorded on 5-point Likert scale. Then results, total of the 100 patients, among 100 patients, 52 were male and 48% were female. Average age of the patient was 60 years. And VAS score intraoperatively, 90% of the patient reported no pain, 10% reported mild pain. Post-operatively, 100% reported no pain. Likert scale for patient, 90% of the patients intraoperatively rated 5, that they were very much satisfied. 10% rated 4 on Likert scale. Similarly, Likert scale for surgeon comfort was 90% in the cases surgeon rated 5, and in 10% he rated 5. Pupil size at the start of the surgery it was 2.8 mm. At the end of the surgery it was 6.84 mm. And then we have different studies have quoted. They have different pupillary size. In our study it was 7.61 mm plus minus 0.96 am. So in short, I can say in our study, I can say it intracameral combination, it leads to rapid achievement of mydriasis, maintenance of stable pupil during surgery, good patient and surgeon comfort, efficacious and safe. It reduces the preoperative time and as a result total surgical time, and it is a good alternative to peribulbar anesthesia in safe in experienced surgeons' hands. Okay, thank you.